Our keynote speaker, well, many of you have had the pleasure of knowing him beyond his awards and accolades. A few of you recollect him to be a wonderful colleague and a clinician par excellence. Many of you recollect him to be an excellent teacher. Today, he serves as the chairman of Manipal Hospitals and Manipal Healthcare Private Limited. And it's not just that, he's got two distinctions. He was instrumental in setting up the first postgraduate training center for nephrology here in Karnataka, and he was also at the forefront of the state's first cadaver kidney transplantation. Now, he was conferred the fellowship by the Royal College of Physicians in London, and he's a recipient, as I said, of several awards and honors. So we're going to listen to him talk about the current state of healthcare and the need for change in the manner of delivery. This is going to be a peek into the future of healthcare. So please join me in welcoming on stage Dr. Sudarshan Ballal.
Thank you very much for the generous introduction. A very good morning to all of you. At the outset, I would like to congratulate Deccan Herald for setting the stage for the future of a well-planned, friendly, sustainable, eco-friendly Bangalore. That's what we are looking for, because as someone said, from pensioners' paradise to Silicon City is what I have seen. I have lived in Bangalore for a few decades, and I have seen the transition from a population of what it was to about 10 times increase in the population in the last 3 decades. In the next 20 minutes or so, I will share my views on the future of healthcare in the decades to come, not only in Bangalore, but also the rest of the country and the world. So before we dwell on what is the future of healthcare, we need to know the root cause of the problem of not only healthcare, but many other illnesses that ail our country. And what needs to change in our healthcare? We also need to talk about the increasing role of artificial intelligence and technology in healthcare. We'll briefly talk about our experience and look at what the future holds for healthcare, or at least my interpretation of what the future holds for healthcare, and then finally conclude. This is my very, very fond slide that I present in most of my talks, the inequality in the world and the society. What you see here is that the top 20% of the society has 83% of the resources. The bottom 20% has only 1.4%. Unless we take measures to correct this, at least in the healthcare industry, there will never be a solution to the problems of healthcare. And I want you to keep the champagne glass in your mind whenever you walk the streets of Bangalore or any other city or semi-urban area in India. Certainly, we have come a long way in the last few decades. I still remember my grandmother having a gallbladder surgery when I was in school. Of course, my uncle was the district medical officer, so she had extra privileges. But in spite of that, she had a surgery in an old, dilapidated hospital with a foot-long scar like this, 3 weeks of stay, half a dozen attendants, and that's what it was a few decades ago. And now we have keyhole and robotic surgery with hardly any scars and a stay of less than 48 hours. So there has been progress. But the question is this progress enough? The question I would like to ask you, would you fly an airline where a Boeing 747 crashes every day? 400 people die every day in a plane crash. Would you fly that airline? Would you shop at a store where the prices are not posted? Would you go to a bank where ATM transactions would take days or longer instead of a few seconds? Would you check into a hotel where it takes 4 to 6 hours or more to check out? And I'm sure the answer is a resounding no. But unfortunately, you and most of us still accept this in the healthcare industry, because that's what happens. There are 100,000 people or more dying of medication errors. It takes hours to get out of the hospital, and in some places, it's not at all very comfortable being in hospitals. What we envision is the future of healthcare would be very different from what we know now. In most instances, brick and mortar hospitals will be replaced by technology-driven healthcare. It will be an era of smart hospitals and healthcare delivery systems. There will be a major role of artificial intelligence in transforming healthcare. Unfortunately, the medical fraternity and the hospital industry has woken up very late to the much needed changes. When I was in the US, this was a very common thing. You go to the bank, you stand in the queue in front of the teller. Fortunately, the crowds are not as much as we see in India, but still has a long wait, which is totally replaced by an ATM now. No one goes to the bank anymore. It's either net banking or an ATM. So also at airports, this is a very small crowd in comparison to what happens to some of our airports. And now no one stands in these queues. It's all self-service check-ins, pre-boarding, Digi-Yatra, so on and so forth. So there's been a lot of development in the field in many areas. We certainly have moved from a phone of this kind to a smartphone. To me, the greatest innovation in my lifetime has been the smartphone, if you ask me. It does everything. It's a phone, camera, fax machine, and everything else that can possibly done is done with the smartphone. I sometimes wonder what is it that the smartphone cannot do other than not producing babies. So I think that's the state of smartphones now, and this is Steve Jobs younger and before he passed away with the kind of innovation he's done, one of the greatest innovators of our lifetime. However, in the medical field, nothing has changed. 1920s, we saw patients like this, 1960s like this, and in the 21st century, we still see patients like this. The only thing I would like you to see is that some change in the attire. Now, at least in the British system, they don't wear a white coat. You have to roll up your sleeves, and you also have to either take off your tie or put it under your shirt so that you don't spread infection to the patients. That's the only thing that has changed. Nothing much has changed. So the innovation has been very, very slow to catch up in the medical world, but that is changing rapidly. And many people believe that giant tech companies like Google will be the biggest healthcare providers of this planet in the future. There's also a change in the disease pattern we see in India, and it's very unfortunate that a developing country like ours has had a double whammy. While we still have lots of communicable diseases like dengue, chikungunya, COVID, malaria, tuberculosis, so on and so forth, we are fast becoming the capital of the world for non-communicable diseases like diabetes, hypertension, cancer, kidney disease, obesity, so on and so forth. And the statistics suggest that non-communicable diseases or lifestyle diseases account for 60% of the deaths in India now. And this is very, very concerning. So our solution to the healthcare delivery for the future should be focused on primary and preventive care. And the Honorable CM in his budget yesterday seems to have emphasized this quite a bit. Universal health coverage. Most of our patients spend out of pocket. The out-of-pocket expenditure in India is about 60% as compared to 5 to 10% in many of the developed countries. And it is certainly unaffordable. If there was no NHS in the UK or Medicare in the US, people in the US and UK could not afford healthcare because it's awfully expensive. So we need to spend more on healthcare. And of course, what we're going to talk a little more today is the use of technology. Artificial intelligence and digitalization have emerged as a revolutionary force in the field of healthcare, significantly impacting the way medical professionals diagnose, treat, and manage patient care. Artificial intelligence has touched many aspects of healthcare, including streamlining administration, telemedicine, and remote consultations, which were caught in a quagmire of legal and regulatory issues, opened up in a week thanks to COVID. I still remember the last week of March 2020. Within a week, telemedicine and virtual consults became a reality, which was a major boon for the patients because mobility and moving around was impossible those days. Predictive analysis, maybe for the future we would predict a COVID pandemic well before it happened and take the necessary precautions. Efficient diagnosis and treatment, including robot-assisted surgeries, drug discovery, personalized medicine, and all of you have had some kind of a remote monitoring. Not your iWatch is certainly one of them. We at Manipal and many other hospitals use remote monitoring both in the inpatient, outpatient settings. And of course, radiology has taken a leap. Now, radiologists can be anywhere in the world and still look at the CT scans, MRI, X-rays, and report it remotely. We have remote OP clinics, EPHCs, remote inpatient monitoring. We have set up eICUs because at some point it was very difficult to get intensivists. So we set up a monitoring system of an eICU, which has a command center in one of the larger hospitals. And reasonably trained young doctors are there to run the day-to-day care with the help of senior intensivists in the command center. We introduced robotic surgery for the first time in our hospital almost 15 years ago. We have a very robust home care with monitoring devices, and there are many artificial intelligence tools available for patient care. This is how a new hospital would look like: a smart and intelligent hospital, streamlined, interconnected, portable, non-invasive, high-tech systems of the hospital of the future seek to improve patient outcomes, eliminate waste, and help reduce costs. Smart and intelligent hospitals will have registration kiosks, which are already happening, app-based appointments and billing, which I'm sure all of you are using, location tracking devices, electronic status boards, especially when your near ones and dear ones are getting surgery, you're always very tense. So these electronic status boards will tell you what's happening with the surgery, when is the surgery starting, when it will get over, and soon after that, one of the doctors would come and speak to you. We have technology that travels even post-discharge so that the monitoring happens even when they are home, reducing the in-hospital stay. We have charging stations, digital pharmacy, digital dietary inventory, so on and so forth. At Manipal, we view the current situation wearing two lenses: from the patient's perspective, which I believe is the most important, then secondly, from the doctor's perspective. I think what is important is whatever technology we use, it should be affordable, accessible, and the outcome should be the same or better than what is being done today. Now, talking about accessibility, I would like to give you an example of what happened during COVID. We have a lot of patients coming from the north and east of this country for various reasons. And believe it or not, some of them travel 24 to 48 hours by train to spend half an hour with me or any other doctor, and another 48 to 72 hours to go back to their home state. So it's almost a week's journey just for a consultation. I'm a kidney specialist, for a kidney consultation. And during COVID, obviously, the travel was not possible, but fortunately for us, e-consultations became the norm. And I saw one of my patients who had been coming to see me for almost 10 years, spending a week to see me. And I saw him in one of the remotest parts of the country. His granddaughter had iPad with her, and I assumed there was some connectivity. So she was able to connect him on the iPad, and I could see him, he could see me, and we could speak to each other. So I talked to him for about 20 minutes, reassured him. And she had also gotten some labs and sent me the results of the labs. So the whole consultation process was over in about 20 minutes. And as the consultation was getting over, I saw some movement behind his charpoy. It was a small village, I'm sure, where he was sitting in a hut-like situation. And I saw some movement of animal behind him. So I was worried whether there is some wild animal that's come to this site of consultation. Then it turns out there was a cow that was coming back to the cowshed. He was outside at a cowshed in the house, and he was able to communicate with me. And that is the beauty of teleconsultations and technology. What would have taken him a week to come and see me was done in half an hour in the most remote part of our country. Some of the initiatives we have embarked on are remote monitoring, home care, outpatient day care, diabetic management systems, eICUs, step-down ICUs with monitoring system. What happens is whenever patients are very sick, they go to the ICU. It's terribly expensive. People don't like to be in the ICU. It's claustrophobic being there. So in the olden days, we couldn't move them because the minute you move them, there is no monitoring. So we moved. Now we have monitoring systems in the wards, which is as good as the ICU. And with these monitoring systems, our rate of sudden deaths in the floor has come down by 90% or more, because we can predict who's going to become sick and we move them back to the ICU if necessary. We do different kinds of robotic surgeries and elderly care monitoring. E-consultations we talked about. Certainly we are working very hard on improving patient experience. And I'm sure most of the adult Indians have diabetes. And it was a pain to prick yourself to check your sugar. And this is one of the reasons why people never check their sugars at home. However, now they have this continuous glucose monitoring devices. This patch is put on the skin. You have a reader, or it can be attached to your phone remotely, and you can continuously monitor your sugar. And this has been a very, very important tool in the management of diabetes, both for the patient and for the doctors. And we, for the first time in this part of the country, set up a remote ICU in a patient's house, and he stayed there for 2 months on a ventilator with all the monitoring and real-time information being sent to our team at Manipal Hospital at 1/4 of the cost of being in ICU. So all this has happened only because of technology and the way we are able to harness technology, and this is going to go a long way in the way healthcare is in the future. We have elderly monitoring devices. India is becoming more and more into nuclear families. The aging population is increasing. Many of the elderly people are in old age homes because their children are not here or they're abroad. And obviously, they're always worried about their health. We have these remote monitoring systems for the elderly. And in our experience, we tied up with one of the elderly homes. And in the last 1 year, we've had more than 150 consultations that have taken place using these devices and the platform. There has been a 46% reduction in the cost of care of these elderly patients, because in the good olden days, any symptoms, they had to come to the hospital, wait in a queue to see the doctor, and the whole day was gone. More importantly, there was an 83% reduction of the need for routine outpatient visits. The readmission rates in the hospital amongst the residents has been reduced. And more than anything else, there is a sense of confidence and comfort among the elderly that healthcare is just a click away. I had the fortune of visiting Lake Nona in Orlando, Florida, where they have one of the most advanced healthcare systems in the world. And I do believe that our generation is truly blessed to be witnessing the greatest scientific and technological developments ever to happen in the history of mankind. I would like to share my predictions for healthcare in 2040. And obviously, it's going to be very different from what it is today. We do believe that we are going to move from treating illness to creating wellness, from hospital care to home care. Other than people who need surgery and who are acutely ill, they should not be in the hospital. They should be in outpatient departments or under home care or ambulatory care. From primary clinics to e-clinics, where a robot will check you up instead of a doctor, and this is already happening. I saw a demonstration in one of the tech companies some time ago. From conventional capture of vital parameters like what was being done and lab checks, to smart devices, I'm sure many of you are wearing them, either implanted or attached to the skin or mucous membranes, which monitor and transmit data to the computers. This data is utilized on a real-time basis with the help of artificial intelligence to interpret and inform doctors. At times, based on the pre-programmed recommendations, it will suggest appropriate remedial measures. From conventional pharmaceutical medications to pharmacogenomic therapy individualized to a given individual, this is based on the individual's genomic characteristics with nano delivery systems for drugs to target individual sites, organs, or cells. From absolute despair for people with serious genetic diseases to an early detection, complete cure through genetic modifications or gene therapy and transfer. This is already happening in some diseases like sickle cell anemia, so on and so forth. From conventional organ donations to growing organs in labs using stem cells and tissue engineering techniques and 3D printing of the exoskeleton of these organs. So there never will be a shortage of organs. From a regular doctor checkup to the doctor telling you how long you might live, to a sample or a simple test to test a telomeres. Telomeres are chromosomes, are genetic things which are attached to the chromosome, just like the aglet of a shoelace. It prevents the chromosomes from getting frayed. and the length of the telomere actually predicts your lifespan, which predict your lifespan. By the way, it is estimated that the lifespan could be close to a whopping 130 years in the few decades from now. From regular surgeries to remove, fix, or replace an organ, to injection of stem cells or genetic transfer through vectors to self-heal. Even if a surgery is inevitable, your surgeon could be miles away directing a robot to do the surgery. If you think this is a flight of fancy, please read my predictions again in 2040 if you're still alive. And I'm sure many of you will be, because I see a lot of young people here. And if you thought doctors will become obsolete, don't worry. We would still be around directing the computers and artificial intelligence for wellness rather than to treat illness. We are at the cusp of entering an exciting new era of practice of medicine, and Bangalore, with its intellectual capital, technological resources, medical device manufacturing, bioscience, and pharma industry will be the most suited to enter the new era with a bang. In conclusion, healthcare delivery of the future has thrown up a very exciting challenge, and it is likely to turn our conventional wisdom topsy-turvy. Unless we, the healthcare givers and planners, adapt to them early, we will perish in the storm of technology and innovation. We certainly don't want to be like this cat which ate the wrong mouse. Thank you very much, ladies and gentlemen.
Thank you, Dr. Ballal. Would you indulge us a few minutes more with a few questions that we have?
Sure.
Before the audience, I would love to ask you, though, you lead one of the biggest medical establishments in the country. Proliferation of secondary and tertiary healthcare in Tier B and Tier C cities, how are you thinking about it?
One of my regrets in life is that most of our healthcare initiatives, and for that matter, most of the initiatives elsewhere have been restricted to the metros, large cities, and the urban areas. You have the best of hospitals, best of schools, best of hotels in Bangalore. You go about 60 to 100 miles away. It is terrible. In fact, there is hardly any infrastructure available. Not so in Karnataka to that extent, but if you go to some of the more remote areas in the north, the situation outside of the cities is worse. So your point is well taken as to what do we do for healthcare outside of the cities, metro areas, and the urban areas. My answer to this is, one is obviously as we expand, more and more hospitals and doctors and healthcare physicians will move to the periphery. When I came to Bangalore, we are 6 nephrologists for the entire city of Bangalore. So we are now 200 nephrologists just in a matter of few decades. So even if they wanted to, I think most doctors who come out of medical schools now cannot practice in cities. Right. They have to move to the peripheries, and large corporates and even the government has certainly increased healthcare in the peripheries, including district hospitals, Taluka hospitals. And I do believe that our aim should be more at prevention and primary healthcare rather than treating. It's a lot more expensive to treat illness. You should create awareness and prevent illness. And I do believe the government should focus predominantly on primary and preventive healthcare and establish primary and secondary centers at the Taluka levels, have tertiary care at the district level, where now we are setting up medical colleges in almost every district. And then the super specialties can be in the metros or the large cities. And we don't have to have a kidney transplant, liver transplant, and major brain surgery in every taluka. You should be able to move patients back and forth.
Thank you, Dr. Ballal. We'll open the audience for questions. Before you ask us your questions, please identify yourself and your organization who you represent. Please give us a moment while we hand over the mic, and also give us a moment to get the cameras onto you. You may proceed, sir.
Hi, Dr. Ballal.
Hi.
Rajkumar here. I have a question regarding the information explosion that is taking place now. The doctors have to handle patients who come up with a lot of information that they seem to know. How will this go forward in the 2040 vision of yours, wherein the patients themselves come and say that, okay, this is what is happening?
I don't know. Thanks for the question, Rajkumar. I think you have come to my office many times. I don't know if you have come recently. I have a big picture saying that please do not confuse your Google knowledge with my 6 medical degrees. So I warn the patients not to present me with all the Google information they have. I think Google is a great device. I don't travel anywhere now without a Google because you get lost. But in medical practice, I think in addition to the Google information, you need some doctor with experience to interpret it. So I think it has to be a combination of both. I don't chide the patients, but I tell them that not everything that you see in Google is not right. It has to be taken in the right context.
Morning, Dr. Ballal. During the pandemic, we saw a lot of interest, and a lot of people discovered that there is a thing called a primary health care center, which is very close to their home, and it's free, and it's not as bad as they imagine it to be. Do you think that the government-run, the BBMP-run UPHCs, the public primary health care centers, are they heading in the right direction post-COVID, or is it something that happened during COVID because of the need and then they're going back to where they were? And what should ideally happen with respect to ward-level primary health care centers, in your opinion?
As bad as COVID was, which was a black swan event in my opinion, the nobility of the medical profession somewhat got back because of COVID. People realized the importance of healthcare, and the nobility to some extent has come back. And I think a lot of focus has been given to healthcare. In fact, we had the largest allocation to healthcare in that year. And I think the government certainly has strengthened the public healthcare systems after COVID, be it primary health centers. And believe it or not, intensive care was almost unknown in the government sectors when COVID came. And we set up many intensive care setups. Now almost every district hospital has intensive care and ventilator setup. So I think overall there is a significant improvement. And also what has happened because of COVID, there's a very strong public-private partnership. During COVID, the Manipal Hospital and what used to be Columbia Asia Hospital at that time, we had a command center at Manipal Hospital along with the government. The government took the initiative of tying up with all the 30 district headquarters hospitals for a daily review of the COVID patients admitted there. And believe me, without any extra cost, extra personnel, just having this tie-up and remote consultation, we reduced the mortality in the district hospitals by 50%. So these are some of the good things that have happened because of COVID, and we should build on it. We should not forget that as soon as COVID is gone.
Hi, Dr. Ballal.
Hi.
Rajkumar here. I have a question regarding the information explosion that is taking place now. The doctors have to handle patients who come up with a lot of information that they seem to know. How will this go forward in the 2040 vision of yours, wherein, the patients themselves come and say that, okay, this is what is happening?
I don't know.
I have a question for you, doctor. As a medical professional, are you concerned that the general awareness about health only erupts during a crisis and it ebbs when things are normal? And how would you change this if it is true?
Well, I think that's true of everything. I think only when you're in crisis, we start thinking. It's a knee-jerk response, but there's very poor planning. Our aim is to actually educate the public, and we certainly would request help from Deccan Herald and others, because if I talk to people, I may speak to about 100 people. But if Deccan Herald puts it on the first page, there'll be millions of people reading it. I think health awareness is probably the most important because, as I said, preventing an illness is the key. And lifestyle diseases are really becoming a burden on the society. And these are all entirely preventable, and it's in the patient's or the citizen's hands. So we should sort of go out, talk to them, and advise them on lifestyle modifications so that they don't come to see doctors like me.
Thank you very much for your questions. I'm trying to be cognizant now of Dr. Ballal's calendar. Once again, let's hear it up for Dr. Sudarshan Ballal, graciously consented to join us here. And just a moment more, I'd like to call back on stage the CEO of the Printers Mysore and our editor here at Deccan Herald, Sitaraman Shankar, to give a small memento to Dr. Ballal. Now, these lovely mementos have been drawn by our creative powerhouse here at Deccan Herald, Sajid Kumar. And if you have the opportunity to meet all our speakers and our guests on stage. Do have a look at the caricatures that we have made for them. I can assure you they are all delightful. Thank you, Dr. Ballal.